diagnoses and explain it to patients that don't really understand what's going on. And so a lot of understanding what's happening to your body or why you're hurting or why you have headaches is a main reason that you can get better. Once you understand it, then we can understand the treatment plan and then we can go forward with it. I taught technology education, so basically a little bit of shop class and then also some computer stuff. And then I made the transition to chiropractic. My most recent teaching job was in Columbus, Georgia, and that's where I met my now wife, Brandy. She's a teacher at Winter Springs High School, and so she's been there about 5 years now. She's a huge Alabama fan, so it kind of makes a funny dynamic being a Syracuse fan and an Alabama fan together. And so pretty much sports is what dictates our life. It's 100% sports all the time. Some of you guys probably saw on Facebook, we're huge Orlando City soccer fans, so being at the inaugural stadium game this weekend was a lot of fun. So, what else? Again, we just got married a couple weeks ago on the 17th. We did a destination wedding in Key West, which was amazing. We brought all of our friends and family down. It was probably my mom's number 2 on her bucket list to go to Key West, and we forced her to go to Key West. So that was one of those things. Her number 1 is to go to Augusta National, so if anybody has Masters tickets this year, please let me know. So now, everybody has a donut on their plate. Basically what we're going to do is we're going to go through kind of what I look at almost every single day. Almost every day, basically the spine is our main focus as chiropractors. Chiropractors look at the spine because you have all sets of spinal nerves that leave the spine, and that's your electrical system for the body itself. So with our electrician in here, basically that's your central electric box for the house. Each area, your limbs, your fingers, etc., that's the room. Okay, so if sometimes you have the lights go out in a room, you change the light bulb, still not working. If you go back to the electrical box, sometimes the breaker's tripped, maybe we need to look at there. That's what we're looking at, starting from the centralized area of the spine. Now, what can go wrong in the centralized area of the spine is generally your discs. Your discs are your main movement point of the spine. So the bones itself, in the discs, you have a bone on top, bone on bottom, and you have a disc in the middle. Almost every single joint, or every joint, does have a little minor disc in there. The biggest discs in your body, though, are in your spine. What these discs basically do is they centralize water, okay? So you have a centralized nucleus area of water, and then you have fibers that go around it. What these fibers do is that they're very, very porous, so when you move, okay, big science word, osmosis, when you have movement of water, then the water can exchange and you get new nutrients in, and then that will hydrate it back up to a proper height. And so, if we all take a knife and fork and cut into the middle of our donut, you will see the centralized area there is obviously jelly filled. That's kind of basically what's on the inside of your disc. Now, if you smush down on that disc, then what happens to the jelly? It comes out. And so once we smush down on it, and if we keep it smushed, then new water will not be able to come in. What happens when new water can't come in like a sponge? What happens if a sponge becomes dry? It hardens up. What happens if that stays hard inside the body is that the body will put calcium there. That is another term called degenerative disc disease. So what happens chronically if we have these problems is that our body will fix itself with calcium. Once that happens, basically the spinal nerve roots coming out the outside have less room, the hole becomes smaller, and that's what we call spinous stenosis. Now, how does that translate to everyday life? Well, if we sit at our desk too long, or we fall, or we get in a car accident, or we have a workers' comp claim, or we have general everyday life where our discs and the body's not moving properly, then that wear and tear will eventually get worse and worse over time. What we do chiropractically is we analyze the joint movement. If the joint's not moving properly, then we assist it to move properly. So that way, now we have full range of motion. That disc can hydrate to a proper height. The nerve root coming out is more happy, and then we don't have pain. So we have a lot of different diagnoses considering, like plantar fasciitis. A lot of people will come in and say, well, my foot really hurts. I've been dealing with this. I've had 4 or 5 injections over the last 2 years. What's going on with it? Again, going back to the breaker box, we look at the low back because your L5-S1 nerve root, which is your lower back, will go all the way down to your foot. Once we fix that disc and get more hydration in through there, then we can get it to a proper height and the nerve is more happy. So, same thing with headaches. In the upper part of your neck, you don't generally have the very big discs in the upper part of the neck, and so movement in that area will help the nerve roots going into the brain, so people with chronic migraines can actually get a lot more relief with adjustments through there. Now, people ask about safety with the adjustments. Adjustments are one of the safest things that we have. Primarily speaking, if you even just look at our malpractice insurance is the cheapest amongst all doctors. It's extremely conservative. What you want to always do is, obviously, every doctor does a new patient exam, and that new patient exam is going to go through all the tests to make sure that everything's going to be safe for each individual for those adjustments. Pretty much number one reason why people come to a chiropractor is low back pain. We have other issues that we can deal with, especially cervical issues, neck issues, mid-back issues, again, all the way head to toe. My youngest patient that we have right now in the office, currently treating, and again, it's not a big treatment plan, is about 2 weeks old. Adjustments on babies is not what people think. I'm not going to obviously wrench down on their neck or anything like that. Adjustments on babies are literally the same amount of pressure as you would use to itch your eye. Some issues that they might have is torticollis, chronic ear infections, and constipation. Those are the ones that are really, really cool because 1 adjustment, 2 adjustments, they're done. Once we get a little bit older, our bones fuse at age 25. That's why when we all turn 30, we're like, oh my gosh, 30, everything hurts. That's generally because we are losing that excess range of motion in our spine because our bones are fused. And that's when we really want to focus on our disc. In my office here, a little bit different than most offices around town, we use a therapy called flexion distraction. Those of you who've been in the office before know what I'm talking about. Basically, the table is going to move at your hips, and then it's going to distract away. So it flexes at your hips and distracts. When that happens, we create a vacuum inside the disc, and it sucks all the new water in, and then it will push it back, and it pushes all the waste product out. So we do that repetitively over time. Disc herniations, a full-out disc herniation, say like in an auto accident or a workers' comp case, okay? Full-out disc herniation, non-surgical, okay? With medical treatment, again, that's a key aspect because we work very well with medical doctors, has a 93% success rate with flexion distraction to actually have pain-free. Now, as Jim will talk, Brian will talk, once you herniate a disc, it's herniated. It's a permanent injury, okay? Permanent injuries, okay, in low back or even neck is the most common cause of disability in the United States today, from low back pain or neck, okay? That's the most common cause of disability right now in the United States, so you can see how prevalent it is. Currently, about half of Americans suffer from low back pain. Half of Americans suffer from low back pain. Chiropractic only really utilizes about 12% of the population. And so, something that's conservative without drugs, pills, or shots, or even using those things in combination, again, 93% success rate, still is only used 12% of the time. Most of these cases are mechanical in nature, meaning it's not a cancer, it's not a major diagnosis, a virus, etc. It's a mechanical problem, okay? Some of us, engineering minds, type of thing, can understand that. If something's mechanical, we can fix it. We just need to make it move more properly, and we need to make it move, symmetrically on both sides. And when that happens, then the body is going to adapt to it and it will heal itself. And so a lot of these issues, people will come for pain, some people will come for wellness, and some people will come for preventative. And so some people will say, well, why do I need to go to a chiropractor? I'm not hurting. Well, what we do is analyze the spine to make sure that you won't hurt in the future. And so that's why some people have these treatment plans that will be ongoing. Again, for me, I would be leery. Anybody that makes you sign a big contract, you need to come X amount of time. What we'll do is basically we listen to your body, and your body tells us when you pretty much need it. And that's what I talk to different people about. Our treatment plans are basically as we go, okay? I can give you statistics, I can give you averages, but each person's different. Everybody's chemically different. Everybody is hereditary differently. So with those differences, it's hard for me to just give you a number on your first visit. Hey, you need 35 visits. What we do is we listen to your body every single time, and then the eventual goal is to make you guys where it's a maintenance thing. About every 6 to 8 weeks you come in, hey, I want to prevent. If that's not in your wheelhouse, that's fine. It's up to you. Some people don't like going to the gym. Some people don't like doing this or doing that. So we kind of come up with things together. Everything's a combination. Everybody knows their body better than I do, okay? Just because I have a doctorate doesn't mean I know everything better than what we just have to figure it out together and figure out how we're going to fix it. My last little statistic here. Last year alone, this is coming from the Medical Society, Americans spent $50 billion on low back pain, and it was the most leading cause of missed time from work. So again, if it can be conservative or even additional where medical intervention can be used, then I would say that's probably your best bet. Where, a lot of people, they just fight through it, take a couple days off, okay, well, 50% better, and then they move on. So I thank you guys for the time. Hopefully you enjoyed the demonstration. But any questions?
We need